All right. Welcome, everybody. I wanted to introduce myself. My name is Liz Arts. And so today we have an extreme honor. I'm so excited to be with three different Master Chiefs of different generations, different combat services. And we're going to have a conversation about how things once were, how they've changed, what has stayed the same, and we're just gonna have a great time together laughing because sailors do have a lot of fun. We know that. So first and foremost, I'd like for these guys to introduce themselves, and we'll start with Ernie. And Ernie, if you could tell us a little bit about your service, Master Chief, and we'll go from there.
Yeah, my name is Ernie LeClaire. Joined the Navy in 1959. Went to A school at Great Mistakes and went to Corps School there as well. My first duty station was Naval Hospital, Chelsea, Massachusetts, about 40 miles from home. I'm one of those oddball IDCs that went through two IDC schools, never served a day of independent duty during my whole Navy career.
Mhm.
I served on 4 different ships, 3 aircraft carriers and 1 tender. I retired out of Naval Hospital, Portsmouth in 1983 with 23 years, 11 months, and 29 days of active duty service, but I wasn't counting. And I've been retired, good Lord, 40 some odd years now.
Wow. Thank you for your service. Buck, tell us about you.
I'm Buck Miller, and I'm a retired Master Chief Hospital Corpsman. I joined the Navy to run away from home in 1955. Was enrolled, went to Bainbridge, Maryland. After that, I enrolled in Basic Hospital Corps School, Class 5 of 1956. Served 32 years and 4 days on active duty. 17 years of which was serving with the Green Machine, Fleet Marine Force, most of it at Camp Lejeune. I spent a year in Vietnam in 65 and 66, on the ground with the 3rd Battalion, 1st Marines, 1st and 3rd Marine Division. I was also a SEER instructor, teaching Navy pilots and crew members how to evade, resist, and escape capture. I was a POW interrogator during that time, as well as a hospital corpsman. I was a second class and a first class doing that. Like I say, 17 years FMF, best years of my life. I also married to a hospital corpsman. We met in Corps School. She bore 5 children in 6 years, and then we got a TV. Our firstborn joined the Navy right out of high school and became a hospital corpsman, and finally retired as a physician assistant, Commander Medical Service Corps. That's my story, and I'm sticking to it.
That's a good story. Thank you for your service. You're hilarious. All right, Master Chief Jeff, please tell us about your career, sir. Still serving.
First off, gentlemen, thank you for your service. Can't even begin to understand what you all saw way before. So thank you for paving the road. For little Louisiana boys like me, kind of, again, I'd say everyone that the Navy's the only one that had a P-row that could come down the bayou and pick me up. That's the reason I joined the Navy, vice anybody else. But I joined the Navy in 1992. Went to that same Great Mistakes for boot camp and Corps School. Went to Naval Air Station Millington, Tennessee, and did 18 months there after field medical training or field medical service school back then. And then went to 2nd Battalion, 6th Marines, and deployed with the 6th Marines. Thought I knew a whole lot, got out after 4 years, came back in 99. So I did 2 years out. Had to start all over as an E3. Luckily didn't have to go back through field med since I already did it. So went with FSSG, second FSSG, which is now second MLG. Went to the CVN 75, the USS Harry Truman, spent 3 years on there. After that, came back here to Lejeune again as a field med instructor. Went to 2nd Marine Division to 3rd Battalion, 8th Marines. Picked up Chief. Went right across the street to 1st Battalion, 2nd Marines. Deployed with both of those to Afghanistan. After there, went to the hospital because the Force Master Chief at the time told me I wouldn't pick up Senior Chief unless I went to a major MTF. So went to a major MTF and survived. Picked up Senior Chief and then finally got my first stint on the West Coast to the USS Carl Vinson, CVN 70, as the Senior Enlisted Departmental Leading Chief Petty Officer out there. Picked up Master Chief. Spent a little time with Mar 4 Res down in New Orleans because there's an active duty billet down there. After that was the lead detailer for all the hospital corpsmen at PERS in Millington, Tennessee. And then now doing my final Twilight tour here at 29 years. One more to go at Field Medical Training Battalion East as the Command Master Chief.
As
Hoorah.
hoorah!
I never did command master chief. I decided to continue working for a living.
Oh,
That's why I came.
I
That's
became
why I
chief
came
in
here, so I can keep
72
working.
in Naples, Italy. Left Naples and came back to the schoolhouse in Portsmouth and went through medical services tech school. And about 3 years prior to that, I went through the last B school class. And that was also an independent duty school. So I'm one of them oddballs that went to 2 independent duty schools, but never served a day of independent duty. Had a couple overseas assignments. In 1963, I left Patuxent River and I went to Port Lyautey, Kenitra, Morocco for a 18-month tour. I had decided I was going to get out of the Navy in 63, but a month before I was due to get out, my mother passed away, and I went home to bury my mother, and my father had given up the apartment we were living in. So if I would have gotten out, I'd have basically been homeless.
Mm.
So I opted to extend for a couple of years, and it kind of screwed up the personnel department. They didn't know what to do with me. So anyhow, I got a call one day, and the personnel told me I had 2 sets of orders. And so I said, well, where are they? He says, I got a set of orders here to go to Midway Island. I said, what the hell's on Midway? He said, Goonie Birds. And I said, what else you got? He said, Port Lyautey, Morocco. I said, what's there? He said, ugly women. I said, I'm going to Morocco. So anyhow, I did about 9 months there. I also, I made second class. When I came back from burying my mother, my roommate picked me up at the airport, told me I was picking up second class about 15 days after I was supposed to get out. But
Wow.
anyhow, back in 63, they gave us the biggest pay raise they had ever given us since Korea.
Yeah.
I think it was about 14 or 15%. So I went from E4/3 to E5/4 with a significant pay raise, an overseas command. The booze was cheap, the women were accommodating, and I decided this was the life for me. I shipped for 6 and the rest is history.
That is
But
awesome.
I had a great career. When I was stationed in Naples, I became an air crewman and flew search and rescue over there. So I'm a designated air crewman. Flew some SAR missions over there. Came back to the States. I was an instructor. I ended up being an instructor at the schoolhouse here in Portsmouth, and that's where I picked up master. And I got frocked in 1980 in May of 1980, I finally ended up getting paid for it in July of 81.
Mm.
I ended up at Health Science Education Training Command in Bethesda, and my assignment was to standardize IDC school in San Diego and Portsmouth.
Oh,
I
yeah.
had that job of standardizing those curriculums. And anyhow, that was probably one of my best assignments. I really, truly enjoyed that. I had one of my daughters, my youngest daughter, was having some issues, mental health issues, and I had to get a Holmes transfer down to Portsmouth, and I had shipped over in 82, just, but when I came down, they said that if they were going to give me the Hums, I had to put in my papers. So I did. Put in my papers, did 11 months, and retired June of 83.
So you said the standardization,
And
do they still have IDC school? They only have it now in San Diego, isn't that true? Catfish,
Right.
Master Chief?
Correct. Correct. It's in San Diego now only.
Yeah, only in San Diego. I wish it was still in Portsmouth as well, but yeah, they have it now in San Diego, but that's really cool that you were responsible for.
well, they've got 3 IDC designations now. They've got surface, dive, corpsman, and IDCs and sub IDCs.
Yeah.
FMF IDC?
And an FMF IDC. They got 4 IDC designators.
Right.
Yeah.
Yeah.
Okay, so for you, Buck, what would you say? He just said what his favorite part, like probably the most glorifying, or the one of your favorite, one of your favorite assignments was the standardization of the IDC program.
Well, I standardized the curriculum
Yeah.
from the San Diego
Yeah.
and the Portsmouth.
They were different.
Yeah.
Well, Sub Med School in New London was dropping a lot of guys coming out of San Diego. They weren't clinically adept enough to make it through to sub IDC.
Mm-hmm.
A lot of the corpsmen coming out of Portsmouth were doing well. The guys from San Diego weren't, and we noticed that the curriculums were significantly different.
Mm-hmm.
So our job was to standardize those curriculums,
Yeah.
and we pretty much standardized according to what sub med school was. In sub med school back then, they used to have to stand in front of the staff about every 3 months, and they would question them on stuff that they learned from day one. And prior to graduating, they went back to day one and asked them questions about the whole thing. So
Wow.
Yeah.
we instituted that type of testing with IDCs at the time.
That's awesome.
Yeah.
Would
But-
you say, Master Chief, that TCCC and Prolonged Field Care, they're working hard to do standardization, don't you think? Especially Prolonged Field Care right now, to make them the same across, across the different commands, and really, but the branches as well, right?
Yeah, we did the same thing, kind of like Ernie was talking about with that consolidation, because we have FMTV West and then we have FMTV East. So both of us should be,
Yeah.
in reality, teaching the same program of instruction. So we just had a CCRB, which is a curriculum review board, where everybody sits down at the table and basically goes line item by line item of what we're teaching, not actually the delivery of it, but the black and white portion of it. So we did that last week about the prolonged casualty care and emergency whole blood, and pretty much come to the agreement with the way forward with DHA, COTC, and everything. We're going to go specifically line item by line item from them, vice, okay, well, the East Coast does it one way and the West Coast does it one way, which is pretty much my entire time in the Navy, where I've always looked for 2 instructions, because I wonder why the West Coast is doing one thing and the East Coast is doing the other thing, and we all wear Navy on our uniforms. So us in the West Coast are in the process of consolidating right now that our POIs and what we teach, no matter if they graduate from our school here in Camp Johnson or in Del Mar on the West Coast, we're about 98% the same on what we teach as far as our POIs. So no matter what school they come from, they know when they get someone graduating, with the 8404 NEC back in the day that's now an LO3 Alpha, which means they're going to Fleet Marine Force. They're getting basically the same trained sailor once they check on board.
Yeah. That's awesome. That's awesome. Cause that's one of the complaints we had heard before in my shoes, like when I'm selling, they'll say, well, yeah, well, they do it like that on the West Coast, but they don't do it like that on the East Coast. Okay. So Buck, so tell me what was what your most gratifying, operations or stations or commands?
Well, being sent to Vietnam was finally what I'd been trained to do, boots on the ground. And I had been away from field medicine from 62 to 65, and I was a SEER instructor. So I got to 3rd Battalion, 1st Marines, signed me to the BAS, the office, and I was not happy. I had a personality difficulty with the chief I was working for. He was a mat tech, and I was a boots on the ground guy.
Yeah.
So I asked to be sent to a rifle company, and that pissed 3 other first class off because they got sent to rifle companies after I did. I wanted to be with the Marines on the ground. I
Yeah.
didn't want to be in the rear with the pogues.
Hey, I told him that one of your guys taught me what pogue meant. We won't say his name.
I did not want to be in the rear. So I ended up in Lima Company. And I felt, okay, now I'm where I'm supposed to be.
Yeah.
I was wearing glasses, and you can't wear glasses in Vietnam. They didn't have glasses retainers back there. So they would keep slipping off from the heat sweat. So I ditched my glasses, and I did a lot of treatment by Braille.
Oh my gosh.
Okay. Sometimes you just can't see what you're looking for, and you got to feel for it. And so I did a lot of stuff like that. Operation Utah, March 11th, 1966. We stepped into the middle of an NBA regiment and got our ass shot up pretty bad. Had a guy that had a Marine that had made staff sergeant on the first of March, and he was with his platoon. He was the platoon leader, and he took a round right between the eyes.
Oh my gosh.
And I was there to try to save him because he was dead before I even got there. That inflamed me, and just to say I went a little crazy, but as I'm treating the next guy, the company clerk came crawling up beside me and sat down beside me while I'm laying on the ground treating this guy for a through and through leg wound. And I said, "Get the hell away from me." He said, "Well, I want to help you fill out your emergency medical tag." I said, "Get away."
Yeah.
About the time I said get away, a goop popped up from a spider trap and shot him through the left shoulder. Okay. And now I got 2 people to treat.
Oh my
Okay.
God.
Well, one guy, I put a tourniquet on his leg, and I turned to Corporal Harbor and treated his through and through, and patched him up and said, "Now get out of here."
Yeah.
Okay. He says, I don't want to end up like you did. I got work to do.
Mm,
And it was difficult but rewarding because now I'm doing what I trained to do.
yeah.
My maternal grandfather was a orderly in Mass General Hospital. My mother was a nurse's aide.
Yeah.
Medicine was in my DNA.
Yeah.
Okay? Let me do my job.
Yeah.
I had a very successful tour with Lee McCompany. I spent the rest of my tour in Vietnam with Lee McCompany, which we call Lizard Company, because we were always moving.
Yeah.
And our company commander was fleet of foot. And it was that was the most rewarding thing that I ever did. I mean, I felt like this is what a corpsman's supposed to do.
Yeah.
And I ended up spending 17 years with the Marines and loved every day of it. I mean, it wasn't a day that went by that I didn't feel that I was worthy, that I didn't feel like I was less than.
Yeah.
I would give the Marines back everything they gave me.
Yeah.
You know what sailors and sea rations have in common?
What?
Marines eat them both. Remember that one.
I'll tell
Remember
that one next
because
week.
you can use.
I'll tell that one next week.
Yeah, you need to. Yeah, you need to tell that one.
I was one of them overtrained guys, I think. I had a charmed career, to be perfectly honest with you. I really did. I did 2 tours in Morocco, and I came back to the States, got married, and finished off my sea tour on a carrier out of Mayport, the old FDR 42. And then when I finished that, I ended up getting stationed at Quonset Point, Rhode Island, for my shore tour. And back in those days, it was the heat of Vietnam. They were kicking butt over there.
Yeah.
And so they were changing rotation for corpsmen. I was there about a year and a half, and I got a call from my detailer saying that I was either going to rotate to sea, on the East Coast, and then a year-long tour in Vietnam. And I said, yeah, send me wherever you want to send me. But I had a child at that time, and my wife was pregnant for my second son. And the detailer was an old drinking buddy of mine in my first tour in Morocco. So about 2 days later, he called back, and he didn't call back. I got a call from personnel, and they said, you got a set of orders to go to Morocco, accompanied.
Mm.
So I went back for an accompanied tour, which lasted about 2 years.
Mm.
And I went from there to B school, which they don't have anymore. And I graduated top of my class in B school. So back in those days, the detailers would come down with a list of orders, and honor man of the class said, where do you want to go?
Yeah.
Went to Naples.
Oh gosh.
So I ended up going to Naples for 3 years. Came back from Naples. While I was in Naples, I got accepted for ADCOP, which was the Navy would send you to a local college for a couple of years
Associates
to get an associate's degree. So I got accepted for that. And then when I transferred back to the States, I realized at that time I didn't want to become a nurse. So they had a nursing program. So anyhow, I was, laying around waiting for school to start and bored to tears. So I went to the schoolhouse there at Portsmouth and asked the master chief if he had a job for me to do. I had to wait till September to go to school. He said, sure. He asked me if I could type, and I said, sure. And he had a class graduating, so he needed somebody to type orders. And I had just graduated from B school about 2 years before. And he said, listen, he says, we've combined B school and MAT school to medical services tech. And I've got a class starting in October, and you can get an associate's degree in about 9 months.
Oh my gosh.
I said, what do I have to do? He said, go drop out of AdCop and I'll put you into class. So I ended up went to my second independent duty school, aced that,
Yeah.
came out top of my class in that one. And when I was in Naples, the medical officer over there ended up being the senior medical officer on the Kennedy. And while I was in Naples, the Navy sent me to treatment. I was a recovering alcoholic. So they sent me to treatment, and this doctor found out that I was in recovery and that the ship had gotten money to start a program at sea. So we went to lunch one day and he said, "You want to come aboard and start a program
Oh my
on board
goodness.
ship for, for guys?" I said, "Sure, I'd love to do that." So anyhow, another week or so passed and I get a call from the detailer. He said, "Who the hell is this Captain Winger? He's been calling up here wanting you to go to the Kennedy." And I said, "He's got no damn business doing that." And I said, "Well, I've talked to him," and he said, that, yeah, I'd go on Kennedy. And so I did.
That's awesome.
And then I went from there to the Independence to the Puget Sound.
That's
After I left
awesome.
the Puget Sound, I went back to the schoolhouse to teach. So I did. I had a charmed career. I was Vietnam era corpsman, but never served one day in combat, never served a day of independent duty.
Yeah, well, you saved a lot of lives, so it's starting that program, that's for sure.
Well,
Yeah,
I did some of that.
that's
yeah.
awesome. That's awesome.
And I worked in the Navy's alcohol program until I retired, basically.
That's awesome. That's awesome. I've been to so many different commands where the master chief or the the commanding officer, somebody, they're having to send people to rehab or send them something. I mean, all the time, and so I mean, and then, now there's so much attention on it more even because of PTSD. Tell me, Master Chief Jeff Pritchett, um, what do you think your most gratifying tour was? And I know what you're doing now is gratifying. So you don't have to say that since you're sitting in that chair, but tell me a time for you that really was meaningful and something that you kind of, you know, really kind of put an impact on your career.
Of course, I love my job right now. Very, very passionate about teaching these young sailors how to save lives in combat, how to be able to integrate with the Marine Corps, to understand the esprit de corps, camaraderie, and how it's so much different than it is in the Navy, and how the Marine Corps earned that title, Doc. So, love my job now,
Yeah.
right? I don't get to play as much as I did, so I would say for me, my most rewarding would have to be when I was an instructor here, '05 to '08, as a HM2 and HM1. To be able to train, 1,000 students a year, to go, and especially in the middle of a conflict, we were OIF, OEF at the time. And then I know probably everyone that was an instructor here had already been to combat. So coming back, bringing that experience, and then being able to teach that to these students, and then leaving here and going right back to a division unit and deploying as well. But I think for me, my most gratifying is, all these students now that I taught that were, E4s, E3s, E2s, they're all grown up in the Navy and they're chiefs, senior chiefs, and master chiefs, and they remember you as an HM1, HM2, and doing push-ups and going through the mud and everything else we did here, and watching them all grow up, and them, you see them. Even though we're the largest rate in the Navy, we're pretty small, when it comes to the green side. So you see a lot of the same people in different places when you travel around. So, hearing them come back and saying, "Hey, I was deployed with this unit, and what you taught me helped me and kept me alive, or kept my Marines alive," and then seeing them now advance and promotion and becoming chiefs, senior chiefs, and master chiefs as well. I think that's the most gratifying for me over the last 29 years.
That's awesome. That's awesome. And your people totally respect you because I mean, I've seen it firsthand. Let me ask you this. So you've been in, you said you're at your 29th year,
Right.
right? So, how has actual training, like the tools you use to train, changed? Like when I used to work with a master chief. I've told you about it before. He was force master chief and is when he retires, force master chief of BUMED. But he was like, Liz, I've never seen half of this shit. The stuff that we sell, the mannequins, the all of it. He said, we had tourniquets, saws, and whiskey, stuff like that. So, I'd love to hear like what was in your bag, what's in your bag, and what was in your bag, right? Like, or I'm not even saying it right, but the training stuff, what do you think's changed? Because you've been doing this. I mean, a lot has changed in 30 years. I've been doing this for about 9 years and I've seen so much change and it's just going to keep on changing with AI and all that stuff too. So tell me about that. How, has it changed the way you teach? What kind of tools are different? Everything's different, right?
Yeah.
Yeah.
When I
would
went to
say
B
over the
school,
past-
the first independent duty school I went to, I think those chiefs were teaching us stuff that I don't think that curriculum had changed since World War II or Korea. I mean, we were learning about tropical medicine, some of that kind of stuff, jungle stuff. And in pharmacy section, we had to fabricate aspirin. We had to make aspirin out of
No way.
salicylic acid. We had to compound cough medicines. We had to do those kind of things. Now it's off the shelf. I mean, my first duty station was a ward coolie in Chelsea. And we were passing medications out in these glass containers,
1 ounce, 1 ounce.
1 ounce, it looks like a shot glass,
Yeah.
And when patients, I worked on a medical ward where we would even treat retirees, and retiree come in with a heart attack. They had 30 days of strict bed rest. They couldn't move. We had to feed them. We had to bathe them. We had to change their linen. We had to do everything for them. They couldn't move out of bed. Nowadays, they crack a chest, you're going home in the morning, I mean, military medicine and medicine in general, in my lifetime, has changed so much.
Yeah.
Personally, I'm a product of a lot of that. I got more stents in me than you could shake a stick at. I got a titanium left hip, and, it's just so much different than it was, even in core school. We didn't give a shot to a lemon. I gave a shot to my best buddy, and, we learned charting. We had to hand chart
Notes.
Yeah.
notes. We had
Notes
to
and notes.
do treatment notes, past meds, choke, vital signs. We didn't have these fancy machines. We had little glass thermometers that you had to shake down.
Do you remember the old EKG machine?
Oh, hell
In the
yeah.
little wooden
Yeah.
box
Oh, yeah.
with a
Suction
suction
cup.
cup
Oh, yeah.
for
Yeah.
you put wherever you at the leads.
I was stationed at Pax River and happened to be a patient on the ward. I had a dose of what's that? Kissing disease.
Oh, yeah.
Mono?
Mononucleosis.
Yeah.
I was playing tonsil tag with a little wave at a drive-in movie, and she had just gotten out of the hospital with mono. So I ended up on the ward with a dose of mono. Anyhow, back then I was being treated. Well, I also had a strep throat that was raging.
Sure you did.
And they were treating my strep throat with penicillin. They probably don't even have that stuff anymore. But anyhow, there was one corpsman on duty, and the ward was full. He was going nuts trying to take care of patients. So I said, okay, draw up that penicillin. So he did, and he gave me the syringe, and I sat on the bed and I hit myself. And just about the time I hit myself with that needle, he came by, passed out.
Oh my gosh.
He came by and passed out. But one night, in the middle of the night, a woman was admitted, and they didn't have any corpsman that knew how to do an EKG. So they woke me up and told me to go do this EKG on this lady. Here I am in the blue one size fits all jammies,
Yeah.
walking in her room with the machine. And the look on her face was rather staggering. What the heck is he doing here?
You're like, I came for some more mono.
The inmates are running the zoo.
That's right. It's
Yeah.
running the zoo.
All right, tell me, so now, like, hearing that, what type of tools do you use? I've seen, I mean, if you guys saw this amazing facility that they train in, you would die. It's amazing, but tell me, like, how different is it for you, the things you've seen, and, I know you collect stuff too from old timers in the past too, and things like that, but tell me about how you're training and what kind of stuff is different.
So yeah, I can relate to a little bit, not the suction bulb on the EKG machine. I can't relate that far back, but obviously the whole charting, how we came into the Navy, how we were trained in the Navy, probably my first 10 years, where now I'm getting young sailors that, if you ask them to take a blood pressure or anything, they're looking for the little walking corpsman to plug into the wall, so they can take a blood pressure and get a temperature and a pulse rate. So I do
Yeah.
believe, in my opinion, we are getting away from that hands-on effect, right? But, it's technology, right? And technology helps, but can't take technology to the battlefield. And I tell them all the time, I've never rode a boat or rode a bike into combat. We run into combat, so that's what we do down here at Camp Johnson. We run them, until they can't run anymore, and then we run some more. So
Yeah.
definitely, we've evolved. I would say 180 from where I was when I first come in, and where these gentlemen obviously were, in the 50s and 60s and 70s. Because we have mannequins now, where back then, if you were able to have some type of live tissue training, I believe that was the greatest and best training that we could provide before going into combat. But it was far and few between. I think we started off with goats at first, and it became putting in a chest tube in a goat and trying to do a venous cut down on a goat, and stuff like that. And then PETA gets involved, and you got people at the front gate, and then we started an OEMS, an operational emergency medical program, where we started working on pigs, because their esophagus and larynx were as close to what a human being was, to help with, doing emergency crikes, again, doing internal, external jugulars, and stuff like that. And then we were working with um, different type of hemostatic agents, to stop the bleeding and stuff like that. And tourniquet, for me, when I first came in, was a cravat, a stick, and an orange Gatorade ring, right? We've got better tourniquets nowadays, but I mean, I got $94,000 mannequins back there that can speak 16 different languages, cry, breathe, stop breathing, do almost anything and everything under the sun that you can think of, to provide these young sailors the most and best training that we can possibly give them, to where they have it to where it's muscle memory. And that's the biggest thing, the difference in the Marine Corps and the Navy, right? The Marine Corps will jump out of the back of a 7-ton 35 times or 50 times or 100 times till it becomes muscle memory, to where when that one thing happens, that fight or flight kicks in, hopefully that muscle memory
Yeah.
kicks in and they do what they do. And we kind of do the same thing here. We do the crawl, walk, run mentality, spiral technique when we're teaching march pause, we're teaching casualty assessment, TCCC Tier 3, prolonged casualty care, emergency whole blood. We do a crawl, walk, run mentality, where after the 55 days of everything we teach them here, we do a FINEX, a final exercise, where we take them out in the field for a week and we incorporate everything to include the Marine Corps common skills that we teach them, where they have to land nav, day, night, they have to patrol, offense, defense. Then they also take that patient on and have to move it all the way back from that point of X to a casualty collection point, and then back to our sim lab, where we'll run a basic 2 to 3 day prolonged casualty care course in emergency whole blood to give them that full gambit of everything they may or may not see in a combat environment.
That's awesome.
Wow.
That's awesome.
It's amazing, because,
Mm.
and doing a trach, we were just told how to do that.
Yeah,
We were told what,
Yeah,
where
what
the
the field was.
anatomical position
Yeah.
was.
Yeah.
I'd never in my entire Navy career ever had the opportunity to start a trach on anybody.
That's crazy.
Yeah, and I learned a lot of that stuff, but I ended up more on the admin side.
Mhm.
And like I said, had a charmed Navy career. I was absolutely flabbergasted that I made Master Chief. I was at the
You and me
school
both.
command. And about 9 out of 10 guys, all the guys there were former combat corpsmen. They all served a time with the Marines. I was the only one that made Master Chief.
Well,
It's the only one that made Master Chief. I was absolutely blown away.
let me ask you one more question, that I've heard a lot about and read a lot about lately. With the combats that are happening now, have you had to change the way that you're training because of drones? There's these dirty drones, and that how has that changed your training? Because I've read a lot about that. I know there's a lot of different blast wounds now and things like that. How do you train to that?
I don't think we train to one specific entity. What we have evolved after, the I won't say accident, but the scenario that happened, here a couple months ago, with the drone attack and the deaths and the injuries, that we've looked deeper into our TBI criteria and how we're teaching our students to handle that traumatic brain experience and how to handle that, because point of X, in Iraq and Afghanistan, we had the golden hour, right? No matter what happened, where you were, within about an
Yeah.
hour, dust off, PJs were rolling in, they were scooping them up and taking them back to a roll 3 in Bastion and Leatherneck. So we were saving a lot of lives because of that time frame, from point of injury, point X, back to whether they went to a roll 2 and had a shock trauma platoon, or a forward resuscitative surgical suite to go to in between there, or all the way back to the roll 3. We were saving a lot. Now we're kind of training to not to go back to 100% jungle warfare, but point of X, you might not ever get off a point of X. So that's where, the prolonged casualty care comes into, where, you're sitting on a patient 12 hours, 24 hours, 48 hours, 72 hours, and you start looking at sepsis shock and, different types of things and different ways the body starts, deteriorating and things like that, outside of just, hemorrhagic hypovolemic shock. So we're teaching them more internal, and being able to recognize vital signs and understand the vital signs and what the body's going to do, over that long period of time, and sitting in one spot, vice just, stop the bleeding, keep them breathing, and then get them out of Dodge. So I think
Yeah.
we've not really specifically trained to drone attacks, because this is going to sound bad, because it doesn't really matter to us. If they get hit by a tank, they get hit by a drone, they step on an IED, they get a gunshot wound. Whenever it happens, then we spring into action and we go to work. So we don't specifically train for any one scenario. We do give them a bunch of different scenarios, but we are looking at more into the TBI world, and being able to give them as much possible training as we can before we get them to that battalion, and that battalion will do that sustainment training and keep that going.
That's awesome. Well, you guys, all of you, we're close to about an hour. I want to thank you, the three of you, so much for your time, for your service, for your knowledge, for being so cool. Thank you, Master Chief, for giving us your time since you're still working. He's still working today while we're hanging out. So we want to thank you for that.
I would say- I would say to both of those gentlemen, you have a welcome invitation to come down here anytime. If I gotta come get you, just give me an address and I'll come pick you up. But I would love to bring both of y'all down here and
I
let
will
you
come
talk.
and see you, Devil Duck.
I'm
I
with
would
him. I'll
love to
go
get
with
y'all
him.
down here
Oh my gosh,
and
yay!
talk to
I'd
the students.
really love to see your school and
More than
how you're
welcome,
teaching
sir.
these
More than
guys.
welcome.
Those
Oh, thank you. I'll drive them. We'll all come down.
Y'all come on. You
Yeah.
got
I
an
want to
open
see that
invitation.
mannequin with boobs and
Look
pubic
at
hair.
here.
Yeah, he wants to see the boobs.
Yeah, no, he can't, he'll jump it. Devil Doc, it's
He's
been a
trying- he's
pleasure
trying-
visiting with you.
Yeah.
Yes, sir.
Thank you so much.
He's trying to get mono again, huh? He's trying to go back to the
That's what I was
hospital.
just thinking. Yeah, I was thinking, yeah. I don't think that's the first or the last time good old Master Chief over here is going to get mono, the kissing disease. But at least you've got good trainers there, so someone could save him. All right. Well, thank you all for your time. You're awesome. And what do I say? Hoorah or Godspeed? Hoorah, Godspeed, shipmate, sailor. I love you all. All right. Thank you for your service. And we will talk to you soon. All right.
Catch you later, catfish.
Adios.
Yeah. Bye,
gentlemen.
guys.
Appreciate y'all.
Yes. Thank you all.
Oh, God, don't use that word. Gentlemen.
Gentlemen. They're hilarious.
Thank you, shipmates.
There you go, shipmate.
Yeah, shipmate's good.
Shipmate's good.
I like shipmate. I say shipmate. I like
Devil
that.
Doc.
Yes. Okay. Now I'm
Devil
going to
Doc.
learn how to, double dock. How do you turn this off? There we go. Oh, well, I guess I just oh, no, it's still on. Okay. All right. I'm signing off. All right, Catfish.
All right. See y'all later.
Okay. All right. Bye-bye.